everyone. I am Dr. Neeta Ratti from Vital Clinic. I am a practicing cosmetic gynecologist. I am in practice for the last almost since 1980, but I started the cosmetic gynae practice from 1997. It is a very long time since I have been practicing cosmetic gynae. Today again we will be talking about acne, because acne is a problem in which the person concerned is a young child of adolescent age. It could be a boy or it could be a girl, and they are so concerned about their looks at that particular time that they get so much disturbed by it. So now acne, you see, basically it happens at two different age spans. It could be at the adolescent age, also at the perimenopausal age. We have seen ladies in the perimenopausal age group also having acne, because that is again the time of hormonal changes in the body, and same is at adolescence, because this is again the time of hormonal changes in the body. Now what happens is, the acne means what? Acne means because there are hormonal changes, so the sebaceous glands, they are now producing more sebum, you see, and certain people, certain children are prone for developing acne, or in the layman term, if we call it, it's called as pimples, or in Hindi it is muhase. So now these children are so much disturbed because it disturbs their looks, and at the same time they have so much pressure of studies at this time, so they don't want, and they are not used to like taking care of too much care of their skin, or too much worried about their skin at that time. So the worry starts when they start seeing there is some eruption coming up on the face. So now this is basically a complex situation, because there could be multiple reasons for it. One is of course hormonal changes which are happening in the body. Second is, like, if these children start breaking the small eruption or the reddish projection or macule coming up, then it may get infected, and if it gets infected, there is some amount of pus formation in it. Now if there is pus formation in it, so naturally it takes longer time to heal, because the first reaction of children is कि इसको तोड़ दो, break it, और ताकि ये गायब हो जाए. But that's not the answer, and this process goes on and on. Now once acne forms, it may take 2-3 courses. It's like it may either subside in its due course, like 2-3 days the acne subsides, if it is a small size and it is not too deep. Now but if it is deep enough, then it may resolve in of course 3-4 days time, but it will also leave a mark. Now this mark could be initially of course a dark colored mark, and later it may become into a pit or a crater, depending on the size of the acne, or whether it was broken prematurely, or there was some sort of infection super added on it. So now what I have seen, that this acne, if we don't want those marks, we don't want those pits, then the acne should be corrected at the very early stage. Now that means when it has started coming up, so that is the time when it should be taken care of, so that it doesn't go deep enough or take roots into your skin and get prolonged. Because these pits once formed on the face, is very difficult to get them corrected. No matter, there are so many modality of treatments available, like people say microdermabrasion karwa lo, it will get corrected, or maybe using of say maybe some sunscreens, or sometimes people say कि इसको हम एक surgical way ले हम pits को नीचे no-car needles से उसके base को break करेंगे and then put a filler into it. But these are all temporary measures. You see, when you put a filler into it, of course it has a life, maybe 6 months, maybe 9 months. So it's not going to give a permanent correction to the problem which has happened. So I think what I tell the young people, young children is that once the acne starts forming, don't delay. You should start correcting or treatment or maybe the prevention part of it, because that is the time when it can be prevented, and once it is prevented, so naturally it gets corrected. So for this, what treatment we suggest them is, we do two treatments together. That is, we do the reform CRF, which corrects the inflammation of the sebaceous glands which is present there and which is producing more sebum. And at the same time, what we do is we give them alternate sessions of Infuse Ultra, which again corrects the inflammation in the deeper part of skin, tightens the pores, and so the skin becomes smooth. So there are many girls or even boys coming, you know, I'm getting married, or मेरे ये acne आ रहा है, there are marks, I don't look good, how will I face everyone? Or I have got an interview and our clinic is somehow located near where there are people who are going into these air hostesses or maybe this airline cruise and all. So they need to have a very, very clear skin. So now in that case, so if the children start the treatment early, that means they take alternate sessions of Reform CRF, which corrects the deeper layer of skin, and Infuse Ultra sessions, plus if they combine it with Melblok, then of course the pigmentation part can also be resolved. So thank you everyone. This is all what I have to say about acne at this time. And well, if you have any query, you can call us at Vital Clinic. The phone number is 26252333. I repeat, 011 is the code and the number is 26252333. Thank you. Bye-bye. Have a good day.